So we're talking about Lexapro. Escitalopram is the generic name, and it's a antidepressant, SSRI, selective serotonin reuptake inhibitor. So in part, it is thought that major depressive disorder is at least in part caused by a chemical imbalance in your brain, and serotonin is one of those chemicals, the neurotransmitters. And so we're aiming to increase that level of serotonin in your brain, and that's associated with improvement in mood. So that's why we're choosing this medication. There are a lot of medications. Why this one? Why Lexapro? It works very well, has minimum side effects, works very well for a lot of people. And if you ever need to start taking another medication in the future, it usually plays well with other medications too. So it takes some time to work. It doesn't work automatically. It needs to get into your system, start working on that serotonin in your brain. So 2 to 4 weeks. The goal is to really resolve these feelings that you're having of being so low and so depressed, and to improve that mood. So the goal is complete resolution of those symptoms. When you start to feel better, do not stop taking the medication. Because remember, at least in part, the reason why you're feeling better is because you're taking the medication. So continue to take it. We're going to be on this medication, if it works out for us, 6 months to a year, maybe longer. And so just plan on that. If it doesn't work, then we can cross that bridge when we come to it. I'm going to be referring to a document as we talk, and then afterwards I will send you one that is much more user-friendly and easy to read. So you don't have to remember all this information. Just write down the very important things. As with any medication, there are benefits and risks and side effects. We talked about the benefits. Some of the side effects, you might have trouble sleeping. You might have trouble with your GI system, like diarrhea. You might feel like your brain is not working as well, or you're gonna kind of feel flat. And sometimes you might have a lower sexual desire, and very rare, but sweating, bruising, and bleeding. And the more serious, dangerous side effects, seizures, mania, suicidal thoughts. So if those things happen, you want to call an ER. You want to stop taking the medication, let me know. If you have some side effects that we've mentioned that you're like, this is bothering me, but I can handle it, but I want to talk about it, then contact me, all right? It is very unusual for patients also to experience weight gain and sedation, which is a really nice thing about this medication. But again, give it time, give it time, give it time. When you start taking the medication, I'm going to prescribe you 10 milligrams a day. It's going to be one pill, 10 milligram pill. You're going to take it at the same time every day. That's important. You're going to choose the morning or the evening. You can take it with or without food. If you forget to take it, then if it's within 12 hours, go ahead and take it. Then take the next dose as usual. If it's after 12 hours, skip that dose, take the next dose when it's time. Do not double up, all right? Don't do that. It's really safe long term. No concern for addiction, which is also nice too. You don't want to take it with NSAIDs, so aspirin, ibuprofen, naproxen, things like that. So if you are in pain or something, take some Tylenol. I know that you're not pregnant, not planning on becoming pregnant, not breastfeeding. So those are really important things. So that's good. So we are going to wait and watch. When you start taking it, if you experience things like shortness of breath, you feel like you're wheezing, your face or your tongue starts swelling up, you're getting red, itching, then you're going to stop taking that. All right, you're going to stop taking that immediately, and you're going to go to the ER, okay? Because that means that you might be allergic to this medication. It's not likely, it's very rare, but if that happens, go to ER. If you feel like you missed a dose, we talked about that. If for any reason you have taken too much and you're starting to feel certain things like dizziness, lightheadedness, nausea, vomiting, agitation, convulsions. If you take too much accidentally, you want to call the doctor, Poison Information Center, or go to the ER or the nearest hospital, okay, or call 911, because that would be signs of an overdose if you feel like you've taken way too much and you start to be symptomatic. All right, so we are going to wait and watch. We will talk again soon. Remember, give it some time. Give it some time. Some side effects might be normal because you're introducing something new into your body. So give it some time. And then I'm very excited, and we'll talk again later, Tammy, okay? Bye-bye.